Okay, we're back. We're live. It's the 5 o'clock block on a given Tuesday. I'm Jay Fidell. This is ThinkTech, and we have the honor of Dr. Roopmati Khandekar. She's from Pune, India, which is near Mumbai, but she's in New York right now. Thank goodness for that. She's with she has a number of affiliations. She's with the United Nations, among other things, and she is the director of the Global Relations Forum out of India, which is a international relations nonprofit think tank. And she's also with the United Nations, with UNESCO and the United Nations. And we really appreciate her coming on. And we want to talk to her more and more because right now, India is at the top of the news, regrettably, tragically. We're calling this show The Tragedy of the Pandemic Surge in India. Welcome, Roopmati. It's so nice to see you.
Aloha, Jay. It's my honor and pleasure to be here with you again talking. But it's not really pleasurable to talk about the tragedy of the pandemic surge in India, which has hit headlines all over the world so hard. So we really need to investigate as to what is happening in my country. So
yes, well, you know what? One thing you told me just a minute ago, which really struck me, and I hadn't seen it and known it, is that what's happening in India. So if you look at a chart, it's really remarkable how the number of cases shot up. Now 20 million cases, all in the space of a few weeks here in April. This is remarkable. But what you mentioned to me, and I would like to talk to you about it, is this is a function of the variants. India was doing okay, it was doing fine in suppressing the surge, suppressing the number of cases. India is an advanced country as far as medicines and vaccines and therapeutics is concerned, but all of a sudden we have the variants. Can you talk about that?
See, Jake, it is actually about the variant which came, the South African and the Ukrainian variant, which came to the UK. And when that entered India, that is when the surge started. Till that time, last year, India looked like it was surfing the first wave. Prime Minister Modi was providing help to around 150 nations all over the world. India looked like it had it in control. But it is when these super spreader variants that came from the UK, which entered the Indian population, and it has hit Indian population so hard that we have around 350,000 cases every day and around 3,500 deaths counting. So India is accounting for 50% of the global deaths, global infection rate, and 30% of the global deaths. But Jay, I would like to point out at this stage that a very important point, that the 5 states that we have, which are ruled by the opposition parties, they account for 50% of the Indian infections, and they account for 44% of the Indian death rate, while holding only 22% of the Indian population. So the numbers that you are seeing are actually only about 22% of the population. Now, the mismanagement in these 5 states is due to corruption, administration being inadequate, healthcare being inadequate, and the alliances not working as to their capacity. So these 5 states, I have some information on that. These 5 states have just pushed the Indian markers to such a level that it is seeming gruesome. But if you see the Indian overall or the average numbers, they are not that threatening. The remaining 78% of the population is controlling it as per the global scenario. So the surge, the gruesomeness is in these 5 states, which are opposition ruled states. And the mismanagement is really to give a jolt to the BJP government.
Well, you know, Roopmati, if you follow the news in the United States,
yes.
You know that COVID has been politicized, and wearing masks has been politicized, and social distancing has been politicized, for that matter, vaccines have been politicized. Is that what's happening? Is this a a politicized issue? Is that why it's in these 5 states?
Yes, of course it is. Now, I have information about the Delhi government receiving 48,000 vials, suppose, and they will say they have just received 2,000 vials of remdesivir. So, how do you account for the remaining vials? Why don't they reach the people? The center cannot go and give, the central government in the federal structure of India cannot ensure that it has to reach each and every person. They will rely on the state governments to make sure that these vaccines, this healthcare, this medical facility reaches each and every person. If the state governments do not cooperate or they fall short, the central government falls short. And these are the 5 states which are doing the malpractices. So it is the image. See the image of these people. We don't know these people in global politics. What you see is the picture of Mr. Narendra Modi. Prime Minister Modi is the culprit if this doesn't work. But he has been managing this pandemic since 1 year. Now, the problem with the variant is that it spread and it moved so fast in these states, particularly, that it has given a national image. It has created a national image for this global pandemic.
Very tragic, very tragic.
Yes.
That this would happen even at this late date. And you wonder if this is sort of a postcard for the future, a postcard from the future for other countries, including the United States. You cannot assume that COVID is over till it's over. And I think maybe people were assuming it was over in some of these states and come to find, it wasn't over. So you have a bunch of slides and pictures. Can you give us a slideshow, Roopmati, and tell us what you wanted to, discuss and report from these pictures?
This was when India helped when we felt that we were in control of the situation domestically. Prime Minister Narendra Modi took up this initiative known as Vaccine Maitri. Vaccine Maitri, J, means friendship. So he took this up that he would help other countries who were in need. And that's the time when he distributed remdesivir even to the United States of America, the UK, and healthcare facilities. He joined the UN-backed COVAX program, which provides vaccine to low-income and middle-income groups. India is a partner in the Global Alliance for Vaccines. So that way they provide vaccines to low-income groups, low-income countries. So that way, India has taken an initiative in the global pandemic, in the global fight against this pandemic. And Prime Minister Modi, immediately, as soon as he saw that he's domestically secure, he went ahead with helping globally. And
that was very nice of him. And it's ironic that after, he was so philanthropic with other countries, that it should come back and visit India this way. The other thing I wanted to mention is it seems to me that if India was in control or reasonably in control before this happened, and people were either, resistant or vaccinated, and then the variant, creates this disaster. This sounds like an indication that the regular methods don't work to stop the variant, that the variant is so infectious, so dangerous that the regular methods don't work. Am I right? Is this being revealed now?
Yes, the Indian variant is known as B1.617. So that is the variant which has become a arguably more transmissible variant. See, the entire crux of this pandemic is that you have to stop mingling, so that you stop the spread of the virus. As you allow the virus to spread, it will mutate. It will create more mutations, and that is what will create immunity to the vaccines for the virus. So that they will not be effective against any vaccine. So that's why we have to control these spreading initiatives.
It strikes me also that India has correct me if I'm wrong, but 1.3 billion people. There's a lot of people.
Yeah.
There's a lot of areas, especially in the
That's right.
cities, which are overpopulated. I mean, it's very crowded. People living in small living quarters and all that close to each other. And so you have proliferation of cases,
Yeah.
infections anyway. And then when you have a lot of cases and a lot of new cases, the possibility of new variants, not only variants from South Africa through the UK, but variants that are homegrown in India, because there's so many cases, the probability of a variant is that much greater. So you probably have more than just the South African variant operating right now. Am I right?
Yes, yes, we do. We do. See, 1.36 billion people intermingling, so many indigenous setups, the virus will mutate, it will create different variants. Now, this new one, which is come in the Indian variant B1.617, has got 3 new mutations. So now you have to create and because it's more transmissible, and because every 6th to 7th person in the world is an Indian, you're going to have an effect in the global world. So it has to be controlled in India first to be able to nullify, or mitigate the adverse effects of this virus.
Roopmati, a couple of days ago, President Biden closed the border from India, said that there would be no more transportation. Nobody could come to the United States from India, which I suppose that's an appropriate reaction. But the question is that going to work in order to prevent the viruses that are happening in India from getting out of India? And are other countries doing the same thing? So is it possible that the viruses in India will move out of India into other countries in the world, whether the borders are closed or not? Is that possible, and is it happening?
If President Biden has stopped the movement, we have to think about how long. Now, UK is comparatively smaller to India, but the variant did spread all over the world. Now, India is 1.5 billion almost. These people are going to work abroad. They're going to study abroad. The travel ban in the US exempts press, exempts students. One strain, one virus, one is enough to start the spread. You don't need a billion Indians to come to US or a million UK people to come to India. It starts with one and spreads to the world. That's the problem of this particular COVID virus, which is hurting the world. And so travel bans and all is just rather temporary, I feel. And it has to be, it has to go to the next stage of vaccinations, and then finding a reliable, effective vaccine, because these vaccines are partially effective and they have a time limit on the effectiveness.
Okay. Yes. In the US, it's going to learn that too, I think. The other things that come out of the news are 2 things. One is that there seems to be a shortage in distributed oxygen. I don't fully understand that from a medical or public health point of view. Can you talk about the shortage of oxygen, why and what that means, and how it can be alleviated?
Yes, Jay. See, because we are such a large populous country, the healthcare, as adequate it may be, will always fall short of meeting the health needs of the Indian population. Now, in the face of a pandemic, this shortage becomes all the more acute. So you don't have enough of beds, hospital beds. You do not have enough of oxygen cylinders or oxygen, the ventilators for the patients. They are falling short because we do not have those many hospitals or better equipped hospitals or health facilities. Now, what is happening with this government is that they are making makeshift facilities with the army, with the help of the state governments, to convert, say, temples, Indian Hindu temples, mosques, to COVID facilities where they are providing basic oxygen and ventilators. The ICU beds are falling short. because you see there's a large aging population also. If you compare the aging population in 1.36 billion people, it is a lot. It is really a country to take care of just for the oxygen needs. That's what.
Well, my heart goes out when I see people sitting, on the street on a park bench, holding a tank of oxygen, trying to breathe. What it tells you is that, in the U.S., we see, the ventilators and the oxygen masks. We see them in the ICU units of the hospitals. We don't see them on the street. But what it tells you is that in dire, stressful circumstances, people cannot breathe. And their only way to breathe, wherever they may be, and thus stay alive, at least for a little while, is to have oxygen. Is that what this is telling us?
The virus brings out your underlying illnesses also. That's a trait of this virus. So you have panic along with the hidden illnesses that come out, and we don't have those many oxygen facilities in India. CJ, clinics, hospitals are used just for a checkup. For we have a ICU of say 30, 40 beds in a small area. Now, when you require millions of beds and millions of oxygen concentrators, that is falling short. And because of the vaccine diplomacy, I can call it that, vaccine medical diplomacy of Prime Minister Narendra Modi, we have so many countries who are rushing in to help us get oxygen concentrators like the UK, Belgium, Singapore, Saudi Arabia. They're sending oxygen. Even if Pakistan is on animosity, we have historical animosity, they are the ones who are asking, are you okay? So that makes a lot of difference, Jay, that you see global solidarity coming in. Even for oxygen, you understand that this is a basic need of human life, oxygen. And if that is being denied, there is no lower point than that.
Well, tragic.
We are having train booths which are being converted to house isolation cabins. Then we have a Tejas fighter, which is a light combat aircraft, and it was indigenously developed, which the technology to concentrate oxygen was shared by the Indian government to private companies to step up the oxygen production. Prime Minister Modi is setting up oxygen factories as quickly as it's possible. But Jay, it will require time because you're catering to a huge population, which is the virus is spreading like wildfire.
So there's also a lot of news and graphics on the television in the U.S. about, I'm sure you've seen them, about people burning. I guess it's cultural. When you die from a public health kind of threat like this, they make a funeral pyre, and your body is burned. And the photographs and movie clips of all these places where people are being burned. Is that cultural? Is that public health? What does that signify? I doubt this has ever happened in India before. What does it mean?
In Hindu culture, we cremate the body. That is, as in Muslims and Christians, you bury the body. In Hindus, we burn the body. It's cremation, like it used to happen in olden England, Victorian time, or whatever. So, but because you're seeing bodies being burned in parks and streets, that image is hitting people. But it is a cultural point of Hinduism to burn the body. The cremation happens over firewood. It doesn't happen. Electric crematoriums are just a recent development, but cremations happen over fire.
So I have so many questions, but let me ask you one that is pervasive. Is Prime Minister Modi's efforts, his efforts working? This is a really hard problem from a public health point of view, from a medical point of view. And India has a significant technology in medical technology, but is this working? Where's the light at the end of the tunnel on this? I mean, it's every day you hear about more cases. Every day you hear people saying that this is, just getting worse. What does it look like going forward?
It's the world is sitting on this train and we're all going to a destination which we don't know. But when I saw images of the strawberry festival being celebrated in Wuhan, it was without masks and everybody cheering. I think that was the light at the end of the tunnel, that we can get back to normal life, and it won't be this gruesome, and maybe it's a passing phase, but we are getting a big advantage in this, that the healthcare infrastructure is being revamped, is being taken to such a level that it caters to the needs of 1.5 billion people. That is a lot, Jay. We can, as soon as we are done with helping our own population, we can help the world, the income group, countries, and that is what humanity is all about. It is about helping each other, and this pandemic has taught us that we need each other, and unless and it will end for India, it will end for the world. It's like this, we depend on each other, and it just shows that global solidarity is the way forward. And let's move towards that strawberry festival. I hope so soon in India.
Well, the Indian culture is being revealed in all this. The Indian character, the character of the country is being revealed. And one of the things that I have noticed on more than one news story is this volunteer group. There are people in India who volunteer to help others, to deliver oxygen, to help them when they are in extremis, to do anything they can to help their fellow Indian. And you ask them, why are you doing this? Are you doing it for money? No, I'm a volunteer. Are you doing it, for India? Well, yes, I guess so. Why are you doing it? And the answer is something like what you just said. I'm doing it for humanity. I'm doing it because it is the right thing. I care about being, I care about helping people. That's it. And that's so touching. And I wonder if you could comment on the character of the Indian person, the Indian nation, what this is revealing to us about it, and how it is affecting them too.
Jay, my India is not just a country, it's a civilization that has stood the test of time. So it's gone through several of these troubles, these difficulties. Now, this happens when you're talking of volunteers, you have people from every religion who will come and help, whether it's the Sikh Association, whether it's the Hindu RSS who comes, with whether it's the Muslim youth who will come and help you. They do not see religion at the end of it all. You can talk that India is divided on the basis of religion, so many religions coming in, and it's happening, it's a chaotic situation. But when you're seeing this today, you see Muslim youth picking up and helping Hindu bodies to the crematorium, Hindu youth going and helping Muslim families. So it's too interlinked and too intermingling to see these people use the oxygen that you were talking of. It's known as lung. You know what's langar? The Sikh Association. They provide food in the gurudwaras, their temple of worship, but they are providing oxygen langars. That is, they are providing oxygen to the people who need it in cars. That is the way you help in any which way you can, and that is the way, because it's happening on a personal level and it's happening on a global level where nations are helping each other. We have the United Nations COVAX scheme, which is helping transmitting technology vaccines from developed countries to low income and middle income groups. So that is a helping hand. We need this. We really need this.
It tells us a lot about India, about Indian people. One other thing is that, when you have the country all tied up in this over at least, a year, and then now more, intensively a month, it has to have an economic effect. And I wonder if you can speak to how the pandemic has affected India's economy during the years since it began, but also during this, especially threatening time now.
This virus, this pandemic which came in, Prime Minister Modi had to start with educating people about words like isolation, quarantine. They were difficult words for social distancing for the population to digest. They did not know. Then he started a Janta curfew, which meant that people had to self impose curfew and stay inside their house. That's how he brought this nation to a halt and introduced the concept of a lockdown. Now, after we had that lockdown last year, we are having mobility curfews. That means your mobility is curbed for a few hours, like in different different states for different time periods. But you see, Jay, 1 week of mobility curbs cost India $1.25 billion 1 week. So that is a lot, and we have a huge unorganized sector which works on daily wages, on subsistence living. They do not have monthly wages or salaries. If you go for a 7-day lockdown, it hurts their stomach. They do not have food to eat. So for the Indian government, when you talk of assistance during the pandemic, it starts with giving basic grains and basic food to the population. It is not of providing a job, or it's not of providing clothing. It's of providing basic grains to the population. So that is the difference between curbs and lockdown in India as compared to other countries.
So, Roopmati, you're not in India right now. Can you go back, or are there barriers for you, to return? Has your family been affected in any way, either in India or outside of India?
Yeah, my friends, my loved ones, they got COVID, but they cured themselves through the panic which has set in. You have to a bit of overcome it, unless it's a case which requires emergency medical um, attention. You preferably try to take care of it at home. There are home isolation, home remedies, which are, the turmeric latte, which is so famous all over. That's Ayurvedic medicine to increase immunity. So have that, and you can get cured at home also. It can be life threatening if you have underlying conditions, if you have adverse effects. So there have been uh, loved ones who have been affected. Yes.
Yeah, we have a correspondent in Varanasi, and I guess Varanasi must be one of those areas in India which is hit very hard, and his whole family is sick right now. His whole family, so very, very hard to take. So, what is your advice to the United States? We have not managed this well. In the first year under the Trump administration, we made a lot of mistakes. And I think that had an effect in other countries. It might have had an effect even in India when you see, the president of the United States saying, "Oh, no big thing, no big thing." Then that has an effect beyond our borders. And I really wonder because the media is ubiquitous, and then you can catch what a given president is saying any day, anywhere in the world. So I wonder if the mismanagement here had an effect on what happened in India. Um,
We have the patent issue which is pending with the US government, which, if it given, India can manufacture vaccines at a better rate than it is currently doing. The world's largest vaccine manufacturer, the Serum Institute of India, is located in India and in my hometown, Pune. But you see, only 10% of the Indian population is vaccinated to date with the first dose, and fully vaccinated only 2%. So we need to build up the vaccine production and also develop new vaccines. Now, the US has to understand, and they do understand, when you see the kind of they were initially not reluctant to send help to India when India asked for it. But now they are sending doses of remdesivir and oxygen concentrators. But it's never going to be enough, Jay. We have to all come together as a global village. Globalization sets in very hard now. The concept of global village, it is going to come back haunting us. Like, we have to make it work. We stay in a global village.
Yeah. We're almost out of time, but I want to be sure that I offer you the opportunity to. I know you prepared for the show. You made some slides and you pulled together some graphics. And I wonder if there's anything we missed that you would like to convey to our audience, anything in the slides, anything in the research you've done.
I would like to say that the pandemic, is really, we have to get through this. It is a phase of human cycle, and we have to really get together to work this out. Isolation, social distancing, and vaccination are the only three ways that we can get through this. We have to help our governments to help us. That is the way. You cannot expect the government to come and put a mask over your face, have a mask ready, go and vaccinate yourself. These are the things that you have to do personally. Keep your family safe, keep your friends safe. Uh, and unless each and every person takes this responsibility, you and me will discuss in governments, but the global pandemic is a personal choice and has a very, very personal effect. So
Well, maybe that's the big lesson here, even in the United States, where we live in silos and we're divided in so many different ways. I'm thinking that the true lesson, which I think is, as you say, should be learned around the world, is that we have to think of community. We have to be respectful of our neighbors, our friends, and maybe even people who are not our friends, simply to deal with a threat that could have such devastating effect on the planet. So that's, to me, that's a big lesson that if we have not learned it yet, we are learning it now.
yes, hard way. We're learning it the hard way, but we are learning.
Okay, Dr. Roopmati Khandekar, I really enjoy our discussions. I hope you don't mind, but I would like to, come back with you and talk more about this as it unfolds. I'd also like to explore your work academically, the books you're writing, and of course,
Yes.
The border issue that you wrote the book about between India and the Chinese up in the mountains. I would like to catch up with you on that. So there's another show in your future, Roopmati.
I'm honored. I'm looking forward to it.
Thank you so much.
It's always fun.
Roopmati Khandekar, one of our favorite correspondents. Thank you so much.
Thank you, Jay. Thank you. Have a nice day ahead.
You too. Aloha.